You wake before the hospital does. The city is still folding itself open. You fold the uniform around you like armor, a coffee that tastes only halfway real. Your hands tremble and you don't fight it. This tremble is proof. Proof you are alive. You rehearse the name on the schedule, a litany of syllables that will demand everything. You ride the elevator down. Lights hum. A nurse gives you a look that holds decades. No pity. Just the weathered patience of someone who has seen first days and last days. You nod. You step into the corridor. The hospital breathes differently. It has its own temperature. It has its own language. You listen. Beeping machines, distant intercoms, the soft tap of shoes on linoleum. You check your pockets, not for fear, for habits, a pen, a mask, a sterile cap. You touch them like talismans. You breathe in. Level 2, sterile field. Hands washed until they sing. You scrub, and the sound is a ritual. Water slides under your nails. Soap scents the air. You feel each minute pressing you to focus. Your mentor's eyes are a lighthouse. They are calm, but not indulgent. They hand you instruments the way a parent hands a child a compass. Not to direct, to equip. You gown up. The gown is heavy with expectation. It hugs your arms. Your mask hides your mouth, but not your intent. You tie it tight. The OR lights bloom like moons. They make everything clinical and cinematic at once. On the table lies the patient. A person, not a case. A life with stitches of story. You read the chart again. The words are technical and tender. You repeat them under your breath. You ask questions out loud. Because clarity is kindness. Because it keeps mistakes from becoming tragedies. Level 3. First incision. You stand where you rehearsed in your head for years. This is the moment you imagined in fragments. But imagination never duplicates the weight. You feel the scalpel between your fingers, like a promise. Your hand is steady because your mind is steady. If your mind wavers, your hand will follow. You breathe at deliberate beats. In, hold, move. Each cut is a sentence, clear, intentional. You listen to the room. The scrub tech names an instrument. Your mentor's hand hovers, not overbearing. Your assistant mirrors you, calm, ready. You see tissue the way you learn to see it. Layers and textures. You trace the anatomy like a map. You make a choice. Surgery is decision after decision. You choose small things that cascade. A clamp here, a suture there. You feel the rhythm, a push, a pull. You are inside a choreography where consequences are immediate. You solve problems with focus and humility. When something unexpected appears, you do the most important thing. You stop. You assess. You communicate. Level 4. Time warps. Minutes stretch like taffy. The machines provide a steady metronome. Your watch is meaningless. There are no small details. Every drip, every bead of sweat matters. Your mentor speaks in soft, precise sentences. They teach you to see the invisible, to notice how tissue responds, how subtle color shifts tell stories of perfusion. You find yourself leaning into that whisper of decades of experience. Not to copy, but to anchor. You learn the economy of motion. Each gesture is chosen to conserve tissue, time, lives. Your hands begin to move with a memory that isn't yet yours. It is a borrowed rhythm becoming yours. You finish the hardest part. A relief that tastes like cotton in your mouth. You don't celebrate. You exhale. The team exhales with you. A patient shifts toward stability. You hold that fragility with reverence. Level 5. Closure is a quiet war. You approximate tissue with the precision of a sculptor. Sutures fall into place like words in a sentence. You tie knots that stand like promises. You count sponges and instruments like prayers. You listen for the sentinel sounds, lungs inflating. A monitor's steady tone. You step back. Your mentor offers a look that contains both critique and approval. You accept both. They never hand you certainty. They hand you responsibility. You peel off the gown. Your skin smells of antiseptic and accomplishment. You look at your hands. They are the same and different. You have crossed a threshold. Level 6, aftermath. You sit in a small room with a coffee that tastes slightly better. The adrenaline simmers into reflection. You feel the day's weight in your shoulders. You replay moments like film stills. What went well? What you would do again?
What you would do differently?
Learning is a loop of humility. You call the family. Their voices are fragile relief. You speak plainly and kindly. You let them hold a piece of certainty. You step outside into daylight. The world is ordinary. Cars, people, pigeons. You are both small and enormous. You carry the knowledge that you took a life at risk and made it safer. You are tired, but not broken. You are changed, but not unmade. You go home. You wash your hands again. This time, you feel the rituals end. You lay your head down. You let the day's images soften. In the quiet, you promise yourself one thing: to keep learning, to keep listening, to keep putting the patient at the center of every decision. Because skill without compassion is empty. Because courage without care is reckless. Tomorrow will bring another set of names, another set of decisions. You will show up. You will be afraid. You will be steady. You will remember the tremble from this morning, and you will let it remind you that you are alive. That life, in its most fragile form, trusted you today. You do not forget that.